Let's start talking about blood vessels. We took a look at the hearts in some previous videos, and we have talked about some of these blood vessels. This is the aortic arch right here, taking blood away from the left ventricle for the systemic circulation. The three branches off the aortic arch are the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. To be sure, there's an asymmetry off the aortic arch. That is to say, we have a left common carotid here, but we do not have the right common carotid coming off the aortic arch. To find the right common carotid, we need to proceed along the brachiocephalic artery until it splits into the right common carotid artery and the right subclavian. So we have the right subclavian, right common carotid, left common carotid, and left subclavian. Superior vena cava has the right and left brachiocephalic veins dropping into it. Looking at this slide right here is a very blurry slide, but it's good in showing the continuity of this vessel right here. This is the left subclavian artery, which turns into the left axillary artery, which turns into the left brachial artery. This is the exact same vessel that has different names depending upon where it is upon its course of travel. And certainly the same would be the case with the right subclavian artery. It would turn into the right axillary artery and right brachial artery. Looking here, this is the right side of the thoracic cage. This is the pectoralis major. This is the right deltoid, giving rise to the right arm right here. And what we can see right here, this is the right common carotid artery. So the bifurcation of the brachiocephalic artery would probably be somewhere around here into the right common carotid artery and the right subclavian artery. When we get into the armpit region, it becomes the axillary artery and then the brachial artery. The same is true for the veins. Once again, this is the right brachiocephalic vein, left brachiocephalic vein. We have the right subclavian vein dropping into the right brachiocephalic vein. The right subclavian vein actually merges into the brachiocephalic vein along with the right internal jugular vein. The same is true on the left side. Left internal jugular vein, left subclavian vein drop into the left brachiocephalic vein. And here we can see this is the brachial vein, this is the axillary vein, and this is the subclavian vein. This right here is the cephalic vein, which drops into axillary vein, maybe right on the border of the axillary region and subclavian, but I would call this still the axillary vein. So the cephalic vein drops into the axillary vein right here. Those are just a few of the blood vessels above the diaphragm.